I'm Silas Odom. I'm a physical therapist, and I will be running through a pre-practice exercise program for string players experiencing musculoskeletal disorders of the hand, wrist, or neck. The first exercise we're going to be running through is called neck roll plus prayer stretch. In this exercise, my patient is going to demonstrate the first component, the neck roll. In this one, you're going to let the head hang down and roll it to the left and then roll it to the right. One full to the left and one full to the right is considered one. We're going to be doing 10 of these. Now, at the same time we're doing these, we're going to be doing what's called a prayer stretch. This is where you'll put the hands together and have the palms flat, and then press the hands straight down to get a nice stretch in the front of the forearm. Now, you'll be doing these in conjunction with the 10 neck rolls. Once you finish the 10 neck rolls, you can stop doing these exercises. The next exercise is similar to the last exercise, in which it's called neck roll plus reverse prayer stretch. My patient will demonstrate the first component, the neck roll, the same as we did the last time. One full rep is considered looking to the left, then looking all the way to the right. Now, while we're doing these, we're going to be doing what's called a reverse prayer stretch. Similar to the prayer stretch shown in the last exercise, we're going to put the back of the hands together and have a stretch in the back of the forearms. So for this one, we're going to have the hands together, and then instead of pressing down to get a stretch, we'll press the hands up. Now you'll continue this until you do 10 full neck rolls. Once you've completed 10, you can stop this exercise. The next exercise is called a pronation and supination isometric. In this exercise, we're going to be working pronation, or palm to the ground, and supination, which is palm to the ceiling. For the pronation isometric, we're going to start with the right hand and the thumb straight up in the air, and you're going to take your left hand and grasp your right wrist with the thumb of the left hand in the palm of the right hand and the fingers on the back of the wrist. And now with the right hand, you're going to do that pronation, or try to put the palm towards the floor. And with the left hand, you're going to resist that so that it holds it still. And this is considered an isometric. You're going to hold that for 10 seconds. Once you've completed that, you can move straight into the supination isometric. This is relatively the same thing, but instead of doing the palm to the ground motion, we're going to try to do the palm to the ceiling motion. Still resisting, holding that hand in neutral with that left hand. And you can use about 75 to 100% of your force and resisting that with the left hand. Once you've completed two 10-second holds, one in pronation and one for supination, you can switch and do it on the left hand for 10 seconds each way again. The next exercise is called a chin tuck plus a finger extension isometric. Let's start with the first component, the chin tuck. My patient will demonstrate this motion. In this motion, you're going to want to pull the chin straight back towards the wall. You need to be careful not to look towards the ceiling or look towards the ground. You can kind of describe this as trying to create a double chin, or if somebody was trying to touch the front of your nose, you'd pull that head straight back. You're going to perform this exercise with a 10-second hold in conjunction while we do the other component. The other component is the finger extension isometric. In this one, we're going to put the hands together with the back of the fingers, and we're going to press the back of the fingers into each other, trying to extend the fingers backwards. This again is going to be held for a 10-second hold, so we can do these motions in conjunction, doing the chin tuck while doing the finger extension isometric. The next exercise is called a chin tuck plus a finger abduction and adduction isometric. Let's start with the first component again, the chin tuck. This is the exact same as we just did in the previous exercise, pulling that chin straight back and holding for 10 seconds. And we're going to work about 50% of your strength through here. Now, at the same time, you're going to do a little bit more of a tricky motion to understand, and this is an abduction with the right hand and an adduction with the left hand. This is just the idea of abduction being fingers apart and adduction meaning fingers closer together. So with the right hand, if we're doing abduction, we're going to interlock the fingers with the left hand. In this way, the right hand is going to put the ring finger and the middle finger between the left hand's ring finger and middle finger, and then the right index and right pinky are going to be on the inside of the left hand's index and pinky. In this position, we can try to spread the right-handed fingers while also closing the left-handed fingers. We're going to hold this for 10 seconds. At the same time, we're holding the chin tuck for 10 seconds. Now we're going to show you how to flip the hands from the last exercise. That being, we're going to do an abduction, or fingers apart, with the left hand, and an adduction, or fingers together, with the right. To do this, we're going to interlock the fingers again, but this time, our left hand, middle finger, and ring finger are going to go between the right hand, middle finger, and ring finger. And then our left hand, index, and pinky finger are going to go between the right hand, index, and pinky finger. From here, we can try to spread the fingers of the left hand apart while pressing the right hand fingers together. And same as the last exercise, we'll be holding this for 10 seconds while also holding a chin tuck for 10 seconds. Now we're going to move to a median nerve glide. To do this exercise, we're going to first stretch the right arm out straight. And now we're going to do two movements together. We're going to first flex the head to the right, or bend it to the right, while also extending or bending the wrist backwards. Once you've done that, now you can move the head the opposite direction at the same time while bending the wrist towards you. And then you can do the opposite. You're just going to work back and forth through this motion for 10 times, nice and slow. The next exercise is called a hand tendon glide. In these, you're going to have both hands go at the same time. We're going to start by flexing the hands straight up in front of you and bending just the fingers forward at the knuckle, but keeping the rest of the fingers straight, as my patient is demonstrating here. After 10 of these, we're going to go to the next motion. In this motion, you're bending the fingers straight down, almost like you're rolling them up, but not making a full fist yet. After 10 of these, the final motion, you're bringing the pads of the fingers all the way down to the palm of the hand to make a complete fist. And after 10 of these, you have completed this exercise. The last exercise is called a finger independence drill. In this exercise, our arms are going to be in the same position, except now we're going to be putting the thumb together with each finger. So we'll start with the thumb and the pinky together, and then we'll move to the thumb and the ring finger, and then the thumb to the middle finger, and then the thumb to the index. Now we'll do the same thing, but backwards. We'll go to the index, and then to the middle finger, and then to the ring, and then to the pinky. Now we're going to repeat this for a total of 10 times. As you get more comfortable with it, you can pick up the speed as long as you're being very precise with your movements. With many of these exercises, it is normal to experience some discomfort, but it is not normal to experience discomfort that leads to a lot of pain. So if you do experience a lot of pain, back off on how hard you're going at the exercises. Now, when performing these exercises, you should do them before practicing every day. That meaning, if you practice multiple times a day, say at orchestra and then a private lesson, you should perform these exercises before practicing each time, so multiple times a day. Other than that, this concludes our exercise program.